Welcome to Pediatric Advice Hub. Depression in children and teens is a serious issue that often goes unnoticed. It's more than just feeling sad, it can change how they think and act. It can impact their sleep, appetite, energy, friendships, and school performance. And sadly, if untreated, it can lead to thoughts of self-harm or worse. But there is hope. Depression is treatable, and recovery is possible. In this video, we'll discuss how parents can recognize signs at home. We'll also cover what pediatricians can do to help identify and treat depression. Together, we'll explore evaluation, treatment options, and medication safety. And we'll talk about building a support system that truly saves lives. Depression isn't a personal failure. It's a medical condition that affects brain chemistry and mood. For kids and teens, depression can look different than it does in adults. Many parents expect sadness, but it often shows up as irritability or anger. You might notice frequent meltdowns or a drop in school performance. Withdrawal from family and friends is another common sign. Sometimes kids complain of physical issues like stomach aches or headaches without a clear cause. The American Academy of Pediatrics stresses the importance of recognizing these signs early. Research indicates that about 1 in 5 adolescents will face a mental health disorder, with depression being one of the most prevalent. But there's a challenge. Access to child psychiatrists and therapists is often limited. Pediatricians frequently step in as the primary mental health care providers. That's why the AAP encourages pediatricians to get comfortable with depression screening and treatment. Timely care, even in a primary care setting, can prevent suffering and save lives. How do we diagnose depression in young people? One of the most practical tools is the PHQ-9, or Patient Health Questionnaire 9. This simple 9-question form is recommended by pediatricians and parents alike. Each question reflects a key symptom of depression experienced over the past 2 weeks. Let's explore these symptoms together to help everyone recognize the signs. First, little interest or pleasure in activities. Kids may lose interest in things they once loved, like sports or video games. Next, feeling down, depressed, or hopeless. Persistent sadness that doesn't match events is a red flag. Then, trouble with sleep, either insomnia or oversleeping. A teen who can't get up for school might be struggling, not just being lazy. Feeling tired or having little energy is another sign. Depression can drain both physical and emotional energy. Watch for poor appetite or overeating. These can indicate disrupted mood regulation. Next, feeling bad about oneself or a sense of failure. Low self-esteem and self-critical thoughts are common. Trouble concentrating can also be a symptom. Falling grades or forgetfulness might stem from depression, not ADHD. Look for changes in movement or speech. A child may become unusually quiet or restless. Finally, thoughts of self-harm or feeling better off dead are serious warning signs. Any mention of self-harm must be addressed immediately. It's an emergency. Each symptom is rated from 0 to 3 based on frequency. The scores are then added up to assess severity. A score of 0-4 means minimal or no depression, while 20-27 indicates severe depression. Pediatricians may repeat the PHQ-9 to monitor progress over time. A 7-point decrease usually means meaningful improvement. For parents, this scale shows that depression is real and measurable. Tracking these scores helps families see recovery in action. For kids facing mild to moderate depression, we can start making a difference right in the pediatric office. Psychosocial interventions are key and often don't need a mental health specialist. First up is psychoeducation, helping families see that depression is an illness, not a weakness. We explain symptoms, the expected course, and why routines matter. Next, let's talk about sleep hygiene. A consistent bedtime, cutting down on screens, and a calm environment can work wonders. Sleep disturbance can both cause and worsen depression. Then there's behavioral activation, or BA. Encouraging kids to engage in fun activities, even when they don't feel like it, can really help lift their mood. Every small step counts in restoring motivation. Problem-solving therapy, or PST, is another great tool. It teaches kids how to tackle everyday problems, like friend conflicts or school stress. And don't forget exercise. Just 30 minutes of walking or playing sports can boost their mood significantly. Motivational interviewing, or MI, is especially helpful for teens dealing with vaping or substance use. It helps them explore their feelings and take charge of their own positive changes. These strategies can be integrated into regular check-in appointments at the pediatric office. They empower families and build resilience, even before considering medication. When it comes to mental health, psychological therapies can be a game changer. Two of the most effective ones are cognitive behavioral therapy, or CBT, and interpersonal therapy, known as IPT. CBT helps you understand how negative thoughts can impact your feelings and actions. By spotting those unhelpful thought patterns, you can replace them with more realistic ones. This gives you a sense of control over your emotions, especially for kids and teens. On the other hand, IPT dives into how our relationships and life events shape our mood. It's particularly helpful for young people dealing with family issues, social isolation, or grief. Both therapies usually involve trained therapists and several sessions, but research shows they can really help reduce depressive symptoms. And when combined with medication, especially in more severe cases, the results can be even better. When depression becomes moderate to severe, medication might be necessary. Antidepressants can help when other treatments aren't enough. The first-line options are selective serotonin reuptake inhibitors, or SSRIs. Fluoxetine, known as Prozac, is approved for kids 8 and older. Escitalopram, or Lexapro, is for adolescents 12 and up. We usually start with a low dose and gradually increase it. Pediatricians will monitor progress weekly at first, then every other week. It's important for families to know about the FDA's black box warning. This warning highlights a potential increase in suicidal thoughts when starting medication. But remember, untreated depression poses a much greater risk. Most kids start feeling better within 2 to 4 weeks of the right dosage. To prevent relapse, medication is often continued for 6 to 12 months after feeling better. Suicide prevention is a shared responsibility for all of us, parents, teachers, and the community. Every child facing depression deserves a personalized safety plan. First, we need to recognize the warning signs and triggers that can lead to crisis. Next, let's list some coping strategies, like listening to music or reaching out to a trusted friend. Breathing exercises can also help in tough moments. It's crucial to remove lethal means, secure firearms, and lock up medications. And don't forget to have emergency contacts ready: parents, clinicians, and crisis hotlines. The 988 Suicide and Crisis Lifeline is available 24/7 for anyone in need. Remember, asking about suicidal thoughts doesn't cause harm. It opens the door for a safe conversation. Recovery from depression is a journey that requires time and teamwork. It's essential for pediatricians to regularly re-administer the PHQ-9 to monitor progress. Medication tapering should only occur during stable, low-stress times, like summer break. Families can make a big difference by maintaining consistent routines and open communication. Celebrating small victories is key to staying motivated. Remember, setbacks are a normal part of the process. What truly matters is the ongoing support and monitoring throughout this journey. As parents, we often carry guilt when our child struggles with depression, but it's important to remember, this isn't anyone's fault. Empathy, patience, and simply being there are our most powerful tools. Listen to your child without judgment. Let them express their feelings freely. Keep the lines of communication open and avoid minimizing their pain. Saying, "just snap out of it," can be harmful. Depression is a real health condition, not a choice. When families and clinicians unite, the path to healing becomes clearer and outcomes improve significantly. Let's talk about some reliable resources for mental health. HealthyChildren.org offers guidance for parents on depression and suicide prevention. The GLAD PC Toolkit assists pediatricians in managing depression in primary care. https://therichinstitute.org WP Content Uploads 2021-08 GLAD PC Toolkit 2018 PDF, NIMH, and CDC provide national suicide prevention resources you can trust. Awareness, action, and compassion are key in addressing depression and suicide. Parents, trust your instincts and seek help early if you notice signs. Healthcare providers' willingness to screen and treat can truly change a child's life. Together, we can bridge the gaps in mental health care. Every child deserves the chance to thrive. Thank you for joining us in supporting children's mental health.
Thank you for watching Pediatric Advice Hub. We're here to support you with trusted parenting guidance and child health tips. All our videos are based on recommendations from the American Academy of Pediatrics. This helps you make safe, informed decisions for your child. Please remember, our videos are for educational purposes only. They are not medical advice and do not replace a consultation with your pediatrician. Every child is different, so if you have any concerns, always speak with your child's doctor. Be sure to like, subscribe, and stay tuned for more helpful tips in our upcoming videos.